Hello, I'm Dr. David Degatti. Thank you for joining us for today's episode of Catholic Health Stronger Together with Dr. Dave. Today, we are going to discuss how Catholic Health delivers comprehensive cancer care to Long Island. Catholic Health offers easy access to exceptional cancer care and treatment via multiple cancer institutes located across Nassau and Suffolk counties. Each facility is equipped with the most current cancer-fighting technologies. Our Catholic Health Cancer Institutes employ an integrated, multi-specialty approach involving oncologists from several disciplines: medical, surgical, and non-invasive. These specialists work collaboratively to review each case before designing an individualized treatment strategy customized to each patient's specific needs.
As you know, we have 6 hospitals, and we want to continue to provide access to the best level of cancer care across all our institutions with as limited barriers as possible. Walking through the shoes of somebody who has the diagnosis, to give the best evidence-based clinical care combined with the most empathy, caring, love, personalized attention, which is the basic DNA of our Catholic health programs, and combining and merging the two. Because that is what I looked for when my family member had the diagnosis of cancer. You want the best care, but you want some support through it. And I think that's what distinguishes us from other, maybe larger institutions. And I respect them for what they do and what they serve. But where we are unique is that we can provide that level of personalized care for each individual as one of us. We live in these communities. We are part of these communities. Our patients are not patients. They are human beings. They're one of us. We have to walk those journeys with them as if we are them, because often we are them.
Catholic Health delivers much more than clinical and scientific expertise. Our care is infused with compassion. Our team of dedicated healthcare professionals assist patients and their families on an emotional level throughout their cancer journey. We earn our patients' trust by offering comforting, compassionate care. This focus on the individual is what sets Catholic Health apart from other care centers and is why our patients highly recommend us to their families, friends, and neighbors. Joining us in the studio is Catholic Health's Director of Thoracic Oncology and Clinical Research, Dr. Ashish Sangal. Why did you choose to work at Catholic Health and Good Samaritan Hospital in particular?
Catholic Health, I was truly impressed by such a large organization which was very patient-focused, and they truly believe in mother standard care treatments, very compassionate care. They have a team of expertise, very compassionate for what they provide in the cancer related journeys for patients and offering to the community across Long Island. So it was a great opportunity for me to truly be a part of this team and to grow and pursue a state-of-art facility of cancer-related treatments which we can offer to our patients, and hopefully also build up with potential clinical trials, treatments which we can help our patients. It's very exciting to be here. as we have these expertise of great individuals and providing care, but also having a great administrative support, it makes us help build up the program. So I'm excited to be here, and as in the past year as I've been here, we have tried to grow, build the program, trying to offer care in all forms and aspects of cancer to the community.
What services are offered at the Cancer Center?
At our Cancer Center, it's a comprehensive team and of expertise involving a multidisciplinary team of medical oncologists. We have thoracic surgeons, general surgical oncologists, radiation oncology. We have services from interventional gastroenterology and interventional pulmonary. We also have ancillary support system, including providing with registered dietitian. We have social workers, palliative care team. We have team members from genetic counseling. All the needs which are around needed for a patient's initial diagnosis to the journey of treatments is all under one center. So we provide all these services. We have our own infusion center where we provide patients with treatments at the site, and we also have a dedicated research team of research coordinators, which also help us to navigate right from patients as the patients come in or being diagnosed to screen them for a potential trial which they may benefit from in addition to our treatment plans.
It's amazing. So it truly is, when you say comprehensive cancer care, it really is comprehensive from the moment the patient steps through the door until if they need state-of-the-art trial enrollment, you can really handle everything. So that makes it much easier for the patient and their family to feel confident that it's not one doctor trying to find another doctor to speak to, that everything is under the same roof. So that's amazing.
And I think that's the goal, is to truly empower our patients, not only trying to make them understand the diagnosis, but they being themselves in charge of the treatments so that they can make decisions, and their family or caregivers are also able to navigate through this journey, because it's a journey. I'm just a part of it, as is my rest of the team, so that not only we help them expedite with their initial diagnosis, staging of the cancer, coming up with a treatment plan, but then empowering them to lead that. Breakthrough treatments tailor-made for our patients, which goes, is the word which we call is precision medicine. And, we are in that era right now.
I am very impressed by the fact that not only are we doing the best we can through the Catholic health system, and especially at Good Samaritan Hospital, but we've actually taken that next step, that next level that patients really demand in this internet age, that you have partnered with one of the top cancer research centers, arguably in the world, with Roswell Cancer Center. So can you tell us a little bit about that?
Yes, as we have partnered with Roswell Park Cancer Institute, Catholic Health is one of the premier institutes in Long Island, which offers access to various clinical trials which are nationally known. With this partnership, it has given our patients the opportunity to be part of latest research-related studies, innovative and novel therapies for treatment of the cancer. So as we have partnered with Roswell Park, we have it's a National Cancer Institute, or NCI designated cancer research program. So we have access and locally providing all potential nationally known trials. So we have all these innovative trials which can offer to our patients. So in this era, this is a great service that we provide, that in addition to what we have in the community, we are able to provide with potential trials or latest or upcoming breakthrough treatments which otherwise would not be available to the patients.
We need to talk about prevention, right? And lung cancer has come a long way. Lung cancer went from being, you were diagnosed and it was almost a death sentence, to now you have risk factors and let's screen you so we can actually treat or cure. So can you just briefly tell me about the screening that you recommend?
As my focus and passion had been always treating with lung cancers, I've seen a paradigm shift in how lung cancers are treated. And there are new targeted therapies helping with that. But again, we still have lung cancer remains the #1 cause of cancer-related death in men and women across the world. The focus is still to have an early diagnosis on high-risk patients, because having an early diagnosis leads to better outcome by potential surgeries, or if it's not a surgical patient, by using some local radiation, we can save their lives. There had been a national lung screening trial, which is the NLST, which was done almost more than a decade ago in 2007 and eventually published in 2010, where they did screening for high-risk patients ages around 55 to 75 who had smoked more than 30 pack-year smoking history. More recently, the Prevention Task Force, or USPSTF, has decreased that age to less than 50, above 50, and less than 20 smoking history. Again, these are high-risk people who have a potential risk for cancers. So screening them with low-dose CT scan can help to detect cancer. Those studies showed that there's about a 20% chance of decreasing cancer-related death. So 20% mortality benefit, which is very significant in any studies. In a way I can put it as 330 people, if they're screened, one cancer death can be prevented in lung cancer. So bottom line is, other than not smoking, which still remains one of the most preventable cause of lung cancer, its screening can potentially save lives.
Bottom line is get screened.
Get screened.
Get screened. Okay. So thank you, Dr. Sangal. Coming up next, we'll meet a patient who was faced with a devastating diagnosis, stage 4 lung cancer with metastases to the brain. Stay tuned to see how Dr. Sangal and the Good Samaritan team saved the patient's life.
Are you ready to open your heart and home for 18 months to a puppy like Esther? To find out more about becoming a canine companion for Independence Puppy Raiser, visit cci.org or call 1-800-572-BARK. You can make a world of difference in the life of a person with a disability.
Welcome back to Catholic Health Stronger Together with Dr. Dave. Here with us is Catholic Health's Director of Thoracic Oncology and Clinical Research, Dr. Ashish Sangal, joined by his patient, Robert Cunningham, who, following a biopsy at Good Samaritan Hospital in August of 2021, was diagnosed with stage 4 lung cancer with metastases to the brain. Let's hear how Dr. Sangal and the team at Good Samaritan saved Robert's life. Lung cancer is a serious diagnosis, but to learn that you have lung cancer and then it spread, what was going through your mind when you first learned about this?
Well, of course, that makes it more scary, that it spreads to your brain. And, I've done some reading on it, and it basically says, unfortunately, the prognosis is poor. But in spite of that, many friends and family tell me that you have to think positive, and that helps get you through it. So, of course, I did that, and I tried to live my life as normal as possible. I continued playing music, continued doing artwork, continued maintaining my house instead of just sitting around and moping, if you will, Yeah. And I think, that definitely helped by thinking positive.
What were your symptoms? How did this even start?
Well, I'm in the auto body field, and it's kind of a hazardous environment. I've been doing it well over 30 years. I've been a smoker for many years, unfortunately, and so maybe every winter time I'd start feeling a little ill, and I'd go and have a chest x-ray and go to the doctor, and usually it would be maybe a little respiratory infection, but then, I guess it catches up to you, bad habits, and it turned out, I had a bad pneumonia in 2021, and after that cleared up, they can see through the x-rays that it was a cancer in the left lung.
So they tell you that they think that there is a cancer or a tumor or a mass in the lung.
Yes.
And then what happens next? What's the next step?
Well, they weren't really sure. They couldn't really see it until they cleared the pneumonia up, which was cleared, quickly with antibiotics, and then they can see it. And then to, make sure, they send you for a biopsy.
So how do you meet Dr. Sangal?
Once I went for the biopsy, Dr. Chandrika did the biopsy, and, once I woke up, it's like a surgery, you have to be put under with anesthesia. She says, okay, it is lung cancer, as I suspected. And she says, don't worry, 10 years ago, this wouldn't have been a good thing, but we do have treatments now. And
okay.
Of course, she said, stop smoking, which I did. And right away, she told me she called, Dr. Sangal, and he came right down, and he was very caring and, assured me that there was treatments and this and that. And the treatment started shortly thereafter.
Gotcha. So, Dr. Sangal, you meet Robert for the first time. Was it in the bronchoscopy suite? Where was he when you first met him?
Yeah, at the moment we had Robert scheduled for the biopsy in the bronchoscopy suite right after his procedure, because we have, during intraoperative, we have a prelim reports of confirmation of the underlying malignancy. So that we had, and then right away, as he was in the post-op recovering in the bronchoscopy suite, I met him, and we discussed further about what's going on, just to calm him down, to make him understand that more things to do, but we will expedite what is needed, what is the proper staging looks like, what we need to do beyond diagnoses, and then to come and formulate a treatment plan with our comprehensive cancer center here at Catholic Health.
Robert has the bronchoscopy. They do the biopsy. Where is the biopsy sent? It's to the pathology lab in the hospital?
Yes.
And it's read that day?
Yes. We have the what we call rapid on-site evaluation. So our pathologists do come to the bronchoscopy suite to look into the pathology when the specimen is obtained, to see the adequacy of the specimen, and also so that this helps the procedure person, of course the interventional pulmonologist, to look into is it adequate, though they don't have to repeat the procedure. So one is it adequate, what it looks like under the microscope then and there when the patient is still under the anesthesia with the bronchoscopy going on, so that then we call off the procedure, and then the specimen is sent for additional testing, whatever we need for further confirmation. But rapid on-site gives us a prelim report of its cancer, what it looks like, and most of the times this really helps to expedite what we need to do next.
So Robert, you're in the bronchoscopy suite. They talk to you about the pathology and the results. What's going through your mind?
Well, it's definitely scary, you know. I mean, I think most of the time when someone's diagnosed with cancer, you tend to think the worst. But, you know, as I said, you do have to think positive. And once Dr. Chandrika said there was a treatment, you know, and she said 10 years ago maybe there wasn't treatment for that, you know, I felt lucky and had to just start thinking positive.
Yeah, I think we have come a long way, and as we have evolved in the field of oncology, we also understand that having a true multidisciplinary team with a network of all expertise which is required, whether it comes from a pathologist to a procedure person like a pulmonologist, a surgeon, and then the medical oncology team, they all have to be together when we are diagnosing these patients. So we have understood that time is of essence. There is a more set pattern of understanding, not only having a quick diagnosis, but trying to obtain a more accurate and adequate staging for cancer, so that we can create a plan like what it would be needed, a surgery, a radiation, or chemotherapy, immunotherapies, targeted therapies. We need to obtain molecular markers. So all those things have to be kind of sought out in a timely fashion, because the sooner we do that, the better we can formulate a plan, because it really reflects on the survival of patient and their outcome. So, most of the comprehensive cancer centers have what we call a lung center of excellence, something that we have in Catholic Health now, where we have a team of experts which try to navigate right from an undiagnosed to diagnosis to staging to a treatment plan, so that we can move forward quickly to help our patients.
How long after that phone call are they diagnosed, and tell me what happens from that point on?
What we do is we use a nurse navigation system which helps to coordinate these appointments, so that we can come up with navigating through our initial evaluation on the imaging studies, that what it looks like, what is the best way to procure a tissue. Would it be a biopsy through a minimal invasive bronchoscopy with endobronchial ultrasound based staging that is very part of the initial part of diagnosis, and or do we need a percutaneous biopsy, which is a CT guided biopsy by our interventional radiologist, or do we need a thoracic surgeons to go in? We have come a long way in even procuring these biopsies and diagnosis. So we navigate and expedite this within days of patient coming to us with an undiagnosed path or having some questionable concerns of a diagnosis, to getting it to the right place within our cancer center.
The bottom line is twofold. Number one is the diagnosis is going to be made quickly. Now,
Yes.
not every lung mass is cancer, right? But every lung mass creates a lot of anxiety, right? So that's why the being so expeditious in the workup is very important, because the patient is wondering what the heck
Right.
is going on. And number two is we get the diagnosis quickly so we can start treatment. And the beauty of what you've done at your center is you've created a system that is very streamlined. The problem I see, because I'm a cardiologist, but I see it in other areas of medicine, is a patient has a diagnosis, God forbid, of a cancer, and then they're sent to another doctor and then another doctor, and nobody talks. And when they finally do speak to each other, it's weeks, months go by. And not only is that going to delay the diagnosis and treatment, but it will also create tremendous, tremendous fear and anxiety. So it's reassuring that you guys are doing this.
And and you said it right. I think that's so important, because out in the community, sometimes not only because the physicians and the doctors and the offices and appointments, it takes time between one to the other. So not only the timely fashion of diagnosis to staging, but also we go by what we call the NCCN, or the National Cancer Comprehensive Network, and also the American College of Chest Physician Guidelines, or ACCP guidelines, for staging the patients, diagnosing the patients, so that we can come up with an adequate treatment plan. So it's very important, and I think it's an honor to be a part of this team of great experts where we can offer to our patients.
Thank you, Robert and Dr. Sangal. We have to take a quick break, but when we come back, we'll hear from another cancer patient and the support Catholic Health offers its patients.
Discover immunotherapy and find out how your body's natural immune system can become your greatest hope in the fight against cancer. Speak with your doctor and visit su2c.org/immunotherapy to learn more.
Welcome back. Founded in faith, Catholic Health has earned a reputation for delivering clinical expertise coupled with vital social support services. This combination of science and compassion makes the cancer journey easier. Patients and their families are assisted every step of the way by Catholic Health's nurse navigators, social workers, dietitians, as well as pastoral care chaplains and counselors. We support our patients emotionally and spiritually, as well as medically or surgically. Our patients are our partners in fighting cancer. Take a look.
When you're told that you have third stage cancer, you immediately think of death. Like, oh my God, I'm going to die. I'm 50 years old and I'm going to die. And I never got that chance, because immediately I was surrounded by love.
We provide our patients with an individualized program for their care. We provide a multidisciplinary approach. Most of all, we want to provide passionate and a personalized care.
I was beyond impressed from the moment my journey started. Every single person I came in contact with was amazing.
Treat the person as a whole person, and that includes their physical, their spiritual, and their emotional well-being. And it's so very important to us. It's part of our mission.
The Cancer Institute at Good Samaritan Hospital, West Islip, New York, offers the highest quality cancer care close to home. You have convenient access to our compassionate cancer experts who deliver all cancer services from screenings and diagnosis to treatment and survivorship care. Take a look.
Welcome to the Cancer Institute at Good Samaritan Hospital. I'm Lindsay Basilico, the Administrative Director. Here at our 25,000 square foot facility, we house 7 medical oncologists. We have a dedicated oncology social worker, nutritionist, financial counselor, here ready to serve and meet your needs. In addition to those services, we also provide on-site genetic counseling as well as on-site support groups to meet your needs for both those diagnosed and family and caregivers. Our multidisciplinary approach provides the patients and the families to have the convenience of seeing all cancer care specialists under one roof. Here at our 25,000 square foot facility, we host 7 medical oncologists in addition to breast surgery, thoracic surgery, as well as neurosurgery. Here at the Cancer Institute, we also have a state-of-the-art pharmacy as well as on-site labs. This provides dedicated support and convenience for the patient so that they don't have to travel to an off-site facility. The benefit of our infusion center is that we have both semi-private and private infusion chairs. This allows our patients the choice of deciding whether you would like individualized or group setting for your treatment. During your visit with us, you'll notice that we also provide patients and their loved ones a private family education room to address any personalized questions that you may have about your care here with us. In our exam rooms, you'll notice state-of-the-art technology with a modern look and feel. Our center also provides consultation rooms where you can further discuss outside the exam room any additional questions that you may have. The Cancer Institute at Good Samaritan Hospital is also one out of 7 facilities nationwide to earn the Commission on Cancer Outstanding Achievement Award for 15 years. Over the years, our Cancer Institute has evolved to meet the ever-changing needs of our patients. Our partnership with Roswell Park Comprehensive Cancer Center, located in Buffalo, New York, now provides our patients here at our Cancer Institute with direct access to research trials. For more information on this or any of the services that we provide here at the Cancer Institute at Good Samaritan Hospital, you can give us a call at 631-417-8600.
The precision technology Catholic Health employs is making life easier for cancer patients like Robert. These services are available across Long Island. We're giving patients access to the latest technology close to home and under the supervision of some of the most experienced radiation oncologists in our region. Catholic Health's expert cancer services are available at multiple locations across Long Island. The Catholic Health Cancer Institute at Mercy Hospital in Rockville Center, the Catholic Health Cancer Institute at Good Samaritan Hospital in West Islip, the Catholic Health Cancer Institute at St. Francis Hospital in East Hills, and the Catholic Health Cancer Institute at St. Joseph Hospital in Bethpage. Additionally, St. Catherine of Siena Hospital and St. Charles Hospital also offer cancer services and work in close collaboration with the Catholic Health Cancer Institutes. Catholic Health is actively enrolling qualifying cancer patients in clinical trials involving all major cancer types. For more information or to find out if you qualify for clinical trials, please call 844-86-CANCER or email Catholic Health at oncologyclinicaltrials@chsli.org. For more health information, tune into Catholic Health Stronger Together with Dr. Dave. If you would like to know more about Catholic Health Cancer Institute or to make a gift in support of this or another program that is important to you, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. David Degatti, and I hope to see you next time on Catholic Health Stronger Together with Dr. Dave.